Okay, currently, 20 past 8 Monday morning, in uni. Someone's obviously been doing some phosphate and calcium metabolism in this room. The plan for today, we actually have the morning off, or it would be time that we'd normally be spending in the trusts, so we'd be on hospital placement or in community. That isn't happening this week for some reason, so me and my friend Jodie have decided that we are going to go to hospital today and write our second case reports. We handed in our first ones a couple of weeks ago. It might even be last week, the time is flying, and we actually need to hand in another one before the summer, so I think we figured we would do it, or we'd at least gather the data from a patient today. We handed in our first case reports recently. Thankfully I scored pretty well. Only one of the two we have to hand in, so we have to hand in another one before the summer. Only one of the two has to pass. My first one has already passed, as has hers, so I think we've decided that we're going to go and gather the data for the second one today and then hopefully get it handed in before Easter. Okay, so we are here. Say hi, Jodie.
I'm sorry, hi.
We are just heading onto the wards and we're going to find a patient and put them through some tests, take a history, and then try and fill out our case report pro formas. Okay, so we've come out now. It's about 1:15 in the afternoon. It took quite a while. How do you think that went?
I think it went well, actually. I'm quite pleased.
We were able to look at the patient's imaging results and everything like that, so I think we got quite a clear picture of what was going on. Anyway, back to uni for lunch and then CBL. Okay, made it to uni, have a reasonable amount of time to have some lunch, and then we'll prepare for CBL. So I've just got home. It's what are we? 10 past 8. So we had CBL that finished about 5:15. I had my student seminar, which then ran from 6 p.m. Until about 7:45, which was really handy. I've just come back into the house now. I was very cheeky and begged a lift home with one of my student seminar teachers, and was gifted with a piece of cake from Emily, who's been away for the weekend, for the weekend. So that will be really nice dessert. Okay, prepared an extremely non-nutritious dinner of battered chicken and egg fried rice today because it's been a very long day. I'm very tired, and I'm gonna drench this in soy sauce and consume. Eating dinner took about 20 minutes, half an hour off. It's just gone 9:30, and I'm gonna go over the stuff we did in the student seminar, just reworking the diagrams into my own kind of format, so I'll stand a better chance at remembering them when we get into next week, by which time I will probably have forgotten anyway. It's 8 o'clock Tuesday morning. We need to leave the house in about 10 minutes. I've slept through every single one of my many alarms, so that's not a fantastic start. Okay, it's just before 9 o'clock. We're about to have a lecture on injuries to the bones and joints of the lower limb, taught by an orthopaedic surgeon, which should be quite exciting. And my friend Chris is here.
Hi there. Ollie gave me this part, some early morning calories.
Chris forgot to eat a proper breakfast.
It's one of those things. Anki's more important, you know.
Anki is the bane of our existences here. Not flattering at all.
Not flattering.
Just had an anatomy lecture on the shoulder joint, I guess the pectoral girdle, and now we're heading to get some food into lunchtime because I refused to accompany Chris all the way to main campus.
I've been forced to spend an extra £1. How unsightly.
What's the way you put it? It's a low yield.
It's low yield. I'd rather spend an extra £1 and save 30 minutes of revision time. That's
exactly, that's the attitude you have to adopt. It's just gone 2 o'clock in the afternoon. Now we've just had a delightful lecture on skin problems, moles, tumours, that kind of thing, and now we're going to head back home and hopefully get some more work done. So I've come home, had some lunch. It's now approaching 3:30, so I've got about 6 hours before I will need to start winding down for bed. And there's actually 3 things that I want to kind of make a stab at this afternoon. So each is going to get approximately 2 hours. The first thing that I really want to do, obviously I mentioned yesterday that we had been to hospital to get some more case report data. This is my first case report that I handed in a couple of weeks ago. As you can see, I actually think I scored pretty well. The second thing that I want to make a start on this afternoon is the anatomy for this week. I've got my little surgical skull there watching me and telling me to do anatomy. So the easiest way to do this is probably just to show you some quick looks through. Every week we have relevant anatomy to learn that we will then be tested on the Friday, and we get a chance to see in practice. The way that I would typically go about learning my anatomy is in this program, Complete Anatomy 2018. So in this case I want to be looking at the shoulder joint, so I can have a look at the scapula and have a look at all the relevant parts and surfaces and take a look at it in 3D. It's an amazing piece of software. If you're interested in anatomy, it's absolutely fantastic. And I can do things like turn on all the relevant muscular systems, and I can actually see what each of the muscles do. The other thing that I want to do this afternoon is have a look over some of the earlier clinical exams from Block 1, because I'm meeting with Tom and Thoreau in the morning, both of which you've actually seen on this channel before. We are going to be practicing some clinical skills on one another, and so I'm going to try and just prepare myself for that so I don't look like a complete idiot. Now, me personally, there are 2 books that are really good. One of them is called McLeod's. It's a clinical skills book. The other one is this, Practical and Professional Clinical Skills, written by Vinod Patel and John Morrissey. Vinod Patel is actually the clinical skills lead here at Warwick Medical School, so his book is not a bad one to pick up. So after dinner now, I've done a bunch of the anatomy book, and now I'm writing up the notes for the clinical skills exams that we're going to be going over in the morning. So this is what it looks like in full study mode, right? So I've got McLeod's open here. I'm just writing up my thyroid exam notes. So this is the exam that we have to learn as provided in this document, Clinical Skills Course 1. We have 2 of these, but this was sort of early blocks, so before Christmas, alongside the periodic table that I still have from AS level chemistry. Anyway, back up. So McLeod's, the actual clinical skills handbook, the online version of that book down there, my own Word document, and Spotify. Okay, this took a lot longer than I thought it would, but now for the 4 exams of practicing tomorrow, I've made some checklists that we can use to check how good we are at doing all these various types of exams and all the things we have to be able to do. I'm just putting together a little bag of tricks for our clin skills practice tomorrow. So we've got a sphygmomanometer here, blood pressure cuff, a patella hammer, a little pen torch. There's actually the one that came with my stethoscope and my stethoscope itself, and some headphones, which you don't obviously need for clin skills, but if you enjoy music, they're a good investment. Just hit 10:15. I've just spent the last kind of 10 minutes downloading the talks that I've got on YouTube. I've just converted them to MP3 format to put on my phone. So I normally listen to podcasts or lectures or something as I'm going to sleep, so I'll be able to have a listen through those, and I will see you in the morning. Just gone 5 o'clock in the morning. Most mornings I try and be up around this time, just because it then like makes me do healthy things like eat breakfast and go for a run or lift weights or something. Okay, 1 bag, 2 bags. Let us go. Quite snowy morning, going for some clin skills practice, so I need to find Thoreau and Tom so we can maul one another.
Okay, character and volume appears to be normal. Okay, now check radial delay. And could you just sit up for me, please? Okay, that's all fine. While you're up, I'd probably check your lung bases as well, if you can just sit up. Thank you. Big deep breath in, please. And out.
I'll try and elicit Murphy's sign.
Okay.
Now, check for an inflamed gallbladder. So, could I ask you to take a deep breath, please? I'm going to press down hard. Now, breathe out. Okay, negative Murphy's sign.
Okay. Show me shifting dullness.
You would like to see shifting dullness. Okay, so uppercuts over. Try and find any dullness, then ask him to move on to his side.
Okay.
So, we'll just... Okay, there's no signs of fluid, but Tom, can I ask you to roll onto your left side, please? So fluid would run down, and then we'll see if the percussion note changes.
Red is primary, immediate.
Do you need to stabilise the joint or not in a ligament injury?
Yeah, we don't want it to be stretched even more and potentially damage it even more.
Okay, so that was CBL done. We nailed the diagnosis: rheumatoid arthritis and an ankle sprain. But it's what, 2 o'clock? No, it's not even 2 o'clock. 1 in the afternoon. We've actually finished for the day because we have Wednesday afternoons off. So I'm going to go home and learn the brachial plexus. Okay, I was expecting a parcel which doesn't seem to be here, so now I've got to go and do the loop outside the house to try and find it. A bit like an Easter egg hunt, really, because there's a few places around the house that the delivery drivers tend to leave things. So I've got to check all of them now and hope that it's in one of them. Oh, guys, I think we may have parcel. It's a convoluted hiding place. Oh, is this going to be the one? Yes! Yes, it is. Alright, let's have a look-see. I think I know what this is. If it isn't what I think it is, then I have absolutely no idea what it is, because it's the only thing I've ordered. Fantastic. It is what I think. Right. So, this will make more sense to you when I open this up, which has actually been sealed industrially well. Alrighty, what we have here, ladies and gentlemen, is a practice suturing kit. So this is going to be a practice skin pad with several layers to it. We've got some needle holders here, and these are all of the threads. And this is a supplementary thing that I bought. So this comes with needle holders, scissors, and some forceps. So this will be a good opportunity to practice my suturing. Look at that outside. Back home this would be nothing. I bet this grinds the south to a halt. It's 20 to 2, just got home. Again, just like yesterday, I've got a big list of things I want to do. First and foremost, I need to go through the brachial plexus. I need to have some dinner at some point. The snow is actually coming into my room, 2 seconds. So the goal is get brachial plexus done, at least to a level where I understand what it is, what it's made of and what it does. I need to go over the skin lecture that was at the end of Tuesday, and I'm going to allow myself some time to have a play with my suturing kit. Just for reference here, I've got the brachial plexus open in Complete Anatomy 2018, and so I can actually see where everything is and learn about very specific parts of it if I want to. Right, boys and girls, I thought that we could actually open up the suturing kit. I've got the brachial plexus lecture done now. We can actually take a look at what's inside. I don't know how familiar you guys are with suturing. I'm not, I've done it a couple of times now. I'm certainly not, I wouldn't say good or even proficient, but I know roughly what to do, I guess, in terms of actions. Now, I guess they look kind of like scissors, so it's tempting to want to hold them like that. But if we just look at these, we've got obviously 2 rings, which we're going to put 2 fingers through. This one has a ratchet in the middle, which is going to keep it locked, which is quite a good feature. So you have to pull it apart. The way that I was showed to hold these was thumb goes through the upper one, then ring finger through the lower, with your middle finger coming over the top of the loop where your ring finger is, and then your forefinger goes kind of on the shaft or towards the jaws up here to kind of stabilise it, and that's a position in which you get really, really good control. Obviously it's a little bit more control than if I were trying to operate it like a normal pair of scissors. You can see kind of on here that we've got 3 layers to it. We've got the top kind of, it's pretty smooth, it feels pretty rubbery. So this top layer is going to be to simulate skin. Obviously then this red layer was all about thread retention. So if we make an incision in here and then tie it up, that red layer is going to be what's actually, I guess, going to hold the knot in place. So that is those two. I'm just going to pop them to one side a second. Then I assume, I didn't look earlier, but these are going to be our threads. I guess there's a couple of things to note with these. So the first kind of maybe obvious difference is whether it says monofilament or braided. Braided ones they're kind of like a string, sort of filaments wrapped around one another, whereas these are obviously monofilament, one filament. And the other thing is whether they're absorbable or non-absorbable, although these ones all seem to be, I'm sure both nylon and silk are non-absorbable. I'm really not sure about polypropylene. I don't imagine that's absorbable, given that it's a plastic. But basically the only difference there is that absorbable ones will actually break down over time in the body, whereas non-absorbable ones don't. They'll always be actually retained. And I will actually open one of these to show you what they look like. It doesn't matter about sterility when we're doing this, because obviously I'm just using it for practicing on this pad, and I don't think the pad is going to develop an infection anytime soon. We should have a little card, which we do, and on the inside of here is our needle with our thread attached. Going to be very careful not to do myself a Sharps injury, but basically you'd hold that needle with your needle holders, and it's that you'd use to actually thread the suture. Now we're going to have a look in the big bag. So what do we say? Instrapack, the single-use instrument brand of choice. Now I think this is it. Yeah, single use only. This is sterile, I believe. It ain't going to be sterile for long. So pull this open. So again, I bought this separately because, okay, we've got another set. These are the ones I like. Okay, I actually didn't need to buy another set of needle holders, so these have a curve to them, and I actually prefer these. But the other things we get here, we get some suturing scissors, which we can obviously use to cut our threads, and we get some forceps as well. And the only real difference here, I'm not sure how well you'll be able to see, but these are toothed and non-toothed. So these ones, I'm hoping the camera will focus reasonably well. You can see these have kind of a serrated inside edge very finely, which would be better for gripping things, whereas these ones actually have teeth. Because I haven't had my student loan, it was supposed to come in on the 8th of January, it came through on the 26th of February due to some admin error. I've got a ton of cheap food that I kind of stocked up on, which is not massively high quality, but tonight's dinner is going to be boil in the bag rice plus canned chicken curry. I mean, to be fair to it, it does have chunks, chunks of something, I'm not sure what, but there are definitely chunks. There is chunkage going on in this can. Today is going to be very cold. Emily has lent me her hat for this journey to the med school, and I feel like an Arctic explorer.
There is a lot of that one's fun. Are you ready? No. So I hope you know the questions. What muscle is deeper? A. Pectoralis major, B. Pectoralis minor. What is this muscle? Look at the board.
As you can see, it's massively snowy, and we're going to have a look at the pond, which is probably frozen over. Yes, this is definitely frozen water. Okay, it's actually really cold. I'm going back inside. Okay, right, 4 o'clock. We've finished lectures for the day, and now we're actually going to look at a house somewhere outside Coventry to potentially live in next year. Okay, so cut ahead a few hours. It's now 1:55 AM Friday morning. A couple of things have gone on. Firstly, lectures tomorrow, and that's not just lectures, that's all hospital teaching, has actually been cancelled. So as much as I was hoping to get you guys a look inside hospital, I knew that was going to be difficult anyway. Logistically, there probably wasn't a lot I could do. We're actually not going to be in hospital this week because of the snowy weather. It's not been safe to drive. I had to think about it, guys, and obviously hospital hasn't been on. And there are a couple of other issues to note as well. The trust will have its own filming policy, which I wouldn't want to be in violation of, but the big thing is I don't think I would ever feel comfortable filming in a hospital, because obviously there's the identities of the people there involved. I have said which hospital we're at, so I really don't think that filming in there would be something that I'd really want to do. What I can do is give you a very quick summary of what we would normally do. So for me at the moment, in the morning, you'll normally learn how to do 1 or 2 new clinical exams. So last week we did a GALS, screen, gait, arm, legs and spine to see if someone has any problems with any of those areas, and we also did a proper spinal examination as well. Usually after that we'd grab some lunch in the canteen downstairs or from the main hospital building. There's a few shops there. Then you would go to either radiology sessions where you can go and see how imaging is done and how to interpret things like x-rays or Dopplers. There's usually a seminar on a particular aspect of the anatomy that's been covered that week. We then have anatomy proper at the end of the day with the plastinated specimens or very occasionally fresh tissue. And the idea is that you'll sort of go around and have a look at the stuff that's been featured in the anatomy book for that week, and that's taught by clinical education fellows and surgeons as well. So you get a really, really good clinical insight into the important features of each anatomical specimen. We still have snow. So essentially I've spent today what I would call very irresponsibly. It's now 2:30 in the afternoon. I haven't been anywhere, I haven't left this room. What I have done is had 3 more takes at doing this anatomy video, and I've finally got it to work. It's just rendering now, so I'm waiting to see what it'll look like. It'll need another couple of revisions before it actually goes live. So like I said, I'm just waiting for this to render out. So this is the kind of finished project file. It's mostly just a lot of sped up drawing, and while that's going on I've been working on a thumbnail, because you need everything, you need the whole process to work. This is kind of the settled version of the thumbnail. These are actually just other drawings. So we've got Atlas there, the C1 vertebra, we have a drawing of the ventricular system, and I think this is something muscular over here, but this is just kind of the creative process. Played around with the font, you can obviously see my hand here, but then if I show you what it looks like in the export, it's still rendering, but then that's how we get a lovely little thumbnail. Even though hospital's closed, so we haven't been in today, we have decided that we're going to go play D&D at the uni anyway, so I need to go into Leamington to get some snacks. We made it to uni. I'm just going to put this, or make some tea and put this microwavable pizza in the fridge. It took us an hour and a half to get from Leamington to here because of the roads, and Ed, who came from Kenilworth to pick me up, me and him have just been having to help push cars up the hill outside uni because they couldn't get over the crest of the hill. I am absolutely determined to get this video finished and uploaded today. Alrighty, it's like 5:30, 6 o'clock, it must be something like that. and the video is up finally. Draw along anatomy is go, and I'm just gonna work, I think, for the rest of the evening. It's what is it? Yeah, it's 6:20. Okay, yeah, I've got a few hours, so I'm just gonna work, I think, and then have a reasonably early night. So I've got a couple of lectures written up, and actually I thought it wouldn't be a week at Warwick Med School if I didn't show you what using Anki was like. Okay, I realise this is an incredibly dumb angle from which to film this, but it's the best I can do without my phone autofocusing. So, this actually illustrates an example. This is not my Anki deck, but the point is that Anki is a kind of spaced repetition flashcard software. So, if we look at something that I'm actually going to be able to do, let's have a look at vitamin D. I think I know a bit about that. So, we study what are the major physiological roles of calcium. There are 6, I can think of about 4. So we've got, off the top of my head, it's an enzyme cofactor. We use it for muscle signalling. We use it as a secondary messenger in intracellular cascades, and it's used for formation of bones and teeth. Those are the 4 major ones I can think of. Bones, muscles. Oh, nerve function, I didn't get that one. Enzyme cofactor, second messenger. Oh, stabilization of membrane potentials. Okay, then I can rate that. So I didn't get everything, so I'll put it again. This one will pop up in less than a minute. That's basically how Anki works. So I say I would normally use it on my phone. Obviously I can't film myself right now, because I'm using my phone to film this, but it's a really, really good tool, and everyone shares their decks, so different things will work for different people. Okay, so I've come into Leamington this afternoon to try and find the Leamington Learning Grid, which is actually like a university sanctioned and connected space that's somewhere in the town hall in Leamington, so let's hope I can find it. That was a bit of a failed attempt. There were about 30-40 study spaces, and every single one of them was occupied, so I'm going to go to Old Faithful, the Leamington Spa Library. You can see behind me that most of the snow and ice is starting to disappear, so I assume teaching will be pretty much back to normal. And that, ladies and gentlemen, marks the end of this week at medical school. I really hope you've enjoyed the video. I actually picked a really terrible week, clearly, in which to film it because there was a lot of stuff going on. But I really hope you've enjoyed it. It was a lot of fun to make, and if you'd like to see more videos like this, go ahead and subscribe to the channel, like the video to let me know you've enjoyed it, and go and check out PostGradMedic.com, where you can find my daily written blog of everything I get up to. See you soon.